Hi there. So my name is Alistair, and I'm going to talk a little bit about the use of telehealth within the emergency department, which is where I'm hoping to get hired upon graduation. So as I'm sure you know, telehealth is the use of an electronic medium to facilitate access to provider. For the purposes of this project, I'm going to talk about how telehealth can be used in the emergency department to facilitate a telehealth, or excuse me, a teletriage program. So Totten et al. 2020 specifically indicates that telehealth should be targeted towards individuals in rural areas who would not otherwise be able to see a provider quickly. So because of that, I think teletriage program would work really well in areas where it takes a community a significant amount of time to get to a hospital. I think like even if the individual is still going to go to the hospital, they can perhaps go onto the teletriage system on their way to the hospital, right? So as they're driving there, they can get on their portable device and get on the with the provider at the teletriage and let them know their symptoms. At that point, the provider can say, one, you don't have to go in, or two, if it's something major, say for example, signs and symptoms of a stroke, the teletriage provider can start getting all the labs and the stroke team and the CT room ready for the patient so that the minute they touch down onto the premises, they can get going and not have to have a delay of trying to figure out what's going on and then initiate all those changes. So I think that this would work well with people who live in rural areas. It can also provide access to individuals who may have gone into the emergency department but not seen a provider. So Rainmacher et al. 2019 found that the rates of individuals who left the emergency department without seeing a provider dropped with the use of teletriage, specifically when providers were not physically present within the hospital. So at the hospital where they did the study, between 1 and 3 a.m., there was no provider present. And so patients who left without being seen was typically 25.1%. However, after the implementation of the teletriage system, that during that time period of 1 to 3 a.m., the proportion of patients who left without being seen by a provider went down to only 4.5%. And even during normal business hours, when there was a provider physically present on site, the proportion of patients who left without being seen with a provider was only a little bit higher with the teletriage group than with the in-person group. In-person group had a left without being seen rate of 2.6% compared to the 3.8% of the teletriage group. Teletriage has been shown to have the same level of efficiency as in-person triage. So Roadmaker et al. 2019 also found that once the program's implemented and it gets its bearings, that there's no difference in the no significant difference in the amount of patients that are being seen per hour compared to in-person triage. Teletriage has also, when used for patients who present with chest pain, has shown that there's no difference in the standard of care that was received between the teletriage group and the in-person triage group. So I think that teletriage applies to the high reliability principle of sensitivity to operations, particular because for example, in rural areas, there may be difficulty with the staff being able to reach and accommodate patients who are coming from far away and deal with them in a time-efficient manner. So this may help with that. I also think that in hospitals where there's not a staff position 24/7, I know in the area that I came from, there was no emergency department physician overnight. They were all on call because of how small the hospital is. So in areas like that, this would allow an alternative for smoother operations during off-peak hours or during times when the in-person provider is so busy that they can't see every single person there. This would provide another avenue for people to be able to be seen. As always, when something's being implemented, teletriage, for example, should be followed up with continuous feedback from the line staff, the people who are going to be using it on a day-to-day basis, to monitor its effectiveness and usefulness. So implementation of teletriage within the emergency department. If it's implemented within a large hospital, it can cost anywhere between $80,000 and $150,000. However, Cui et al. 2021 did a study in which a teletriage system was implemented in a spinal surgery setting, and it showed savings of approximately $800,000 over the course of 3 years. I wasn't able to find any implementation of teletriage in the emergency department, but I think it's still promising to show that it's been cost-effective in other settings. Implementation would, of course, be a multidisciplinary task that would consist of physicians, nurses, unlicensed assistive personnel, the IT department, and more. With regards to the actual practices of telehealth, that would be the responsibility of the nurse initially to get like a detailed, quick assessment of what's going on, followed up with a teletriage provider who can get further assessments and figure out if the patient does need to come in, and if so, what labs might be needed, and get a head start on what's going to be needed as soon as the patient touches down onto the premises. Ideally, it would be nice to hire a nurse that's specific to the teletriage, that's all they do, along with either a contract or hiring of a physician to solely focus on the teletriage portion of it, so that it can supplement the in-person triage that occurs within an emergency department. Hopefully, the goal would be to incorporate this teletriage system into an already existing system, similar to like the LiveWell app that the Aurora system has, because it would save money, and because it would be easier for people to use since they already use apps such as LiveWell. Ways to monitor the efficiency and efficacy of it. I think the best way to monitor it would be to compare patient rates of use from in-person triage to the teletriage system, along with patient outcomes. So are patients having the same outcomes, like good health outcomes using the teletriage system as compared to the in-person triage system? It would also be important to assess patient satisfaction via some sort of survey. Another important factor to consider is what percentage of patients are leaving without being seen. So ideally, we would want that to drop because it's more resources for patients to be seen by a provider, right? And to go along with that, we'd want to monitor wait times within the emergency department. In theory, if some people are going and utilizing that teletriage system, that should alleviate some of the people that are at the in-person triage emergency department, and hopefully the two combined would decrease the wait times in the emergency department, which is tracked by CMS and other agencies. All the assessments that I just talked about should already be being tracked by the hospital. And so it's just a matter of like going back and doing the data retrieval to see if the program is being effective or not. And so in conclusion, like I said, I think a teletriage program would be great to implement within a emergency department. And here are some references that I used to gather information regarding a teletriage program and its implementation within the emergency department setting. Thank you. And if you have any questions, please feel free to comment.